Good morning and thank you for joining us today. Teresa is working from home and won't be joining us for this session. Over the weekend, we reported 23 cases on Saturday and 19 cases on Sunday. Today, we are reporting a total of 3,097 cases, an increase of 11 cases from yesterday. Out of these 11 cases, 4 are agri-farm workers, 1 is travel related to US, 1 is a healthcare worker, 5 cases are still being investigated at this time. We have 9 cases that are currently hospitalized for COVID, and 2 of these cases are in ICU. With the recent surge in cases, we are starting to see the impact of these COVID cases on our acute care system, as well as in our long-term care homes. We still have 4 long-term care homes in COVID outbreak and 1 agricultural farm that is currently in COVID outbreak. Our team is still managing the community outbreak linked with the residents at the University of Windsor. As our staff at the health unit continue to work tirelessly to provide the case and contact management support for COVID, it is also important for the public to follow all these guidelines to keep their numbers of close contacts low and avoid any high-risk exposure with anyone who do not live with them. On Friday, the province moved us to yellow protect level of province graduated system of restrictions. This means that unorganized public events and gatherings, including social events, barbecues, or private parties, are limited to 10 people indoors or 25 people outdoors. For those organized public events or gatherings, such as meetings, conventions, or other events, which may take place within a convention center, hotel, banquet hall, attendance would be limited to 50 people indoors and 100 people outdoor with appropriate public health measures in place. Capacity limits are also in place for smaller spaces or venues to ensure the amount of people is restricted to the amount which can safely maintain 2 meters of distance between all attendees at any given time. For months, the Windsor-Essex County Health Unit has recommended face coverings in these situations where people cannot maintain 2 meters of physical distancing between them and others. This is especially important in large crowds and public settings wherein multiple attendees are not wearing face coverings. The Windsor-Essex County Health Unit recognizes individuals' right to protest. Protest and demonstration should be conducted in a manner that complies with the Reopening Ontario Act and the recommendations of the local medical officers of health to ensure everyone's safety and limit the potential transmission of COVID-19 in our community. These recommendations include limiting the size of public demonstrations to align with gathering limits under the Reopening Ontario Act. For organized public event, this is no more than 100 people outdoor. Ensuring that individuals maintain 2 meters physical distancing at all times. Wear a face covering if 2 meters physical distancing is not possible. Cough or sneeze into your sleeve or tissue. Wash hands regularly with soap and water or alcohol-based hand sanitizers, and stay home if you're sick. The Windsor-Essex County Health Unit, Police Services, and local bylaw are working together to provide an enforcement approach which prioritizes the safety of those in the community during the COVID-19 pandemic. Organizers of high-risk activities must do their part to ensure all safety precautions and requirements are followed. Thank you.
The conference is now unmuted.
We'll now take questions from the media. Today we'll start with Blackburn.
Good morning. I just guess I'm curious about some of the extra precautions that Dr. Ahmed has put in place over and above what the province did, most particularly the personal care services. I think that's on the orange or red level at the province. Why did you feel that was important to implement now in Windsor-Essex?
Well, one of the most important things that what we are noticing is the spread pattern and where we're seeing some of these activities. And this is true for many of the other jurisdictions as well, that most of these cases are currently spread through social gatherings, social contacts. And we feel that's really important that we give a clear message out to the community what is needed, and the enforcement piece is also something that's very critical in the success of managing this pandemic. And as much as we believe in educating people, working with people, right now, I think we have been doing that for quite some time now, and we feel that it's time that people should be held accountable for their actions.
But just specifically, under the personal care services, no personal care services that require the removal of mask or face covering. Again, I think that's in the province's maybe orange or red level. It's not as part of their yellow one. So why specifically did you feel that, and like the no karaoke, some of the other things that are on the provincial scale later, why did you feel it was important to put those in place in Windsor now, as opposed to, again, when the province puts us in orange or red?
Yeah, no, that's a good question, Maureen. And I think what we are trying to do is we are trying to act proactively in terms of what is coming, looking at what's happening locally and what are some of the high risk activities. We always have to balance that risk of how we can balance the health risk with the economic and social well-being risks that are currently out there. So we recognize that there are many things that are really needed for people to follow and take care of those services and utilize those services. But there are other services that increases the risks to other community members and including the people who are providing those services. So we feel that it's important that we do that. And going back to your karaoke question, and I think I just like to explain it a little bit for our viewers, just for the sake, some people may not necessarily understand why karaoke, what's wrong with karaoke or what's wrong with having a high volume at the restaurant. When we are talking about having all these high volume of music at the restaurant, it forces people to speak louder, and when people are speaking louder, then what they're doing is if they're sick, especially, and through this loud speech, they are throwing their small particles or droplets further down to other people and put other people at risk. And same goes with karaoke. When people are singing and they're trying to sing loudly, that the possibility of vapors going out, droplets going out to other people is high. For the personal service settings, as you know, I think it's self-explanatory that we feel that how can we minimize the risk without affecting the essential services that we are looking for people in our community to get. So personal care settings right now are open, and they can operate given the provincial guidelines, but we feel that we still need to find ways to minimize any potential risk that may arise from it.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Have any more students from the 18-student cohort included in the University of Windsor residence outbreak tested positive?
No.
Okay, and then separately, are all of the agri-farm cases being reported over the last week or two part of the same farm facility?
That is correct, yes.
And I know once one case gets in there, it spreads like wildfire on agri-farms, but did your team find that they failed in any way to comply with public health guidance?
Well, we are working with them right now. There's a number of issues that we're trying to address to prevent the spread at this time. Our inspector is working really closely with the farm to ensure that no further spreads happen. But just like any other businesses, there are things that they could have done better, and we want to make sure that everybody knows it shouldn't happen when they start to see cases. It should happen more proactively. And as I mentioned earlier, what our team is doing right now, our inspectors are going out proactively to each of these farms. And it's unfortunate that this was the farm that our team wasn't in touch with proactively, but we did reach out to other farms. And when we are going there, the whole purpose is to make sure that they have all these things under control before they start to see cases. So far, our investigations obviously have identified a few deficiencies, but we are working with them. It's not as critical, but at the end of the investigation, we'll be in a much better position to say what they should have or shouldn't have done.
Okay, thank you.
Any questions from AM 800?
Dr. Ahmed, just going back to Maureen's question, just looking for clarification on the no personal care services that require the removal of a mask or face coverings. Does that include dentist's office?
No, I think dental office is, we'll see that as the healthcare service rather than when we're talking about personal care service, it's, if I'm going to the barber shop, getting my beard trimmed or things like that. So those are the kind of services that we are concerned about, that if there is a sick individual or maybe earlier on in their infectious period, they could infect it to other people, including the worker who is working with them.
And then the one that caught my eye over the weekend, it just seemed odd to me, the mall instruction one, prohibit consumption of food or drink while walking through the malls. Can you explain that one?
Well, I think what we have noticed that there are people who are either drinking coffee or having other products that they're continuing to consume while they're walking around in the mall. So we wanted to make sure that, if they are sitting and they're eating, and that just like in the restaurants, when you're going there, you have your mask on if you're walking around, but if you're sitting at the table with all these precautions, you can take off your mask and eat, and then you can go out. So similarly, we don't want to give any excuse for people to think that they can walk around the mall and they continue to consume either any kind of beverage or eat while they're walking and talking.
Okay, and then going back to your numbers for today, talking about the hospital, I believe you said 9 in total, 2 in ICU. Now, if I remember correctly, we have had numbers like that in quite some time. Are you obviously concerned? That is obviously alarming, seeing that number?
Yeah, and I think that's where again. When people talk about and we hear so many things, and it's unfortunate that many people who think that they know everything, and they tell all the healthcare providers to what to look out for and what not to look out for. Here's an important message. When you're seeing cases in the hospitals and ICU, that means you already have suffered enough. That's why you're seeing those cases. It's a reality that when you have community cases going up, you are bound to see cases in the hospitals, and you're bound to see cases in ICU. And unfortunately, you're bound to see some deaths that are associated with that as well. And then spread it across to other long-term care home, school settings, other congregate care settings, and then it spreads everywhere. So if you are focusing on just these indicators, and obviously it's a later indicator, you cannot do any proactive work just looking at these numbers. And when we are seeing this many numbers, that is a good indication of what we have been talking about in the last couple of weeks. When cases start to increase, as a result, now you're seeing the number of cases increasing in the hospital system. So definitely a concern from a healthcare capacity perspective, because we really want to make sure that not only we're saving lives affected by COVID, but we also want to save lives and provide services for non-COVID related healthcare needs. Either we are talking about strokes, MI, and everything else. Because at the end of the day, all of these individuals have to go to the hospital to meet those needs. And if there are cases in the hospital, it requires more effort from the staff, from isolation, from seeing many people at the emergency department. It really slows down the entire healthcare system. So I think it is really important that we recognize that, the good part about first wave, and with all the public health measures, all the work that every one of us has done, we prevented that big surge in the hospital. But with the second round of our second wave, we are already seeing cases in the community that are 3 times as high as what the province has seen in the first phase. So it can be a very dangerous situation when the hospital capacity could be overwhelmed. We are not there yet in Windsor-Essex, but we definitely don't want to go there. We have to take all these proactive measures, and we have to act responsibly as a community member to prevent this surge, especially in Windsor-Essex, to keep our community safe.
Do you know off the top of your head, since the pandemic began, what is the most people we've had in the hospital or the most in ICU?
I don't, but if you're interested, Rob, I can have our EPI connect with you. But there may be instances when I remember there was a time when one of the long-term care home and retirement home was under an outbreak, and we have to move people to the hospital to provide care. It was not necessarily a care need that we will say was dire enough that it taxed the hospital other than housing those people. But I'll have to check with my EP and get back to you, Rob.
Okay, appreciate it. Thank you.
Any questions from CBC?
Yes, hi, Dr. Ahmed. Those 9 hospitalizations, do we know the demographic of that? Are these people that are coming from long-term care?
I don't think so that that these people are coming from, like, all of these people came from, I think few of them, and I can try to get back to you in terms of exactly if they are from the long-term care home or if they are from community.
Okay, yeah, that would be great. And then just another question here. Some of the issues that you were mentioning to Taylor from Windsor-Star, just about that farm there. What are some of those issues that you're looking at that potentially led to the spread?
Well, I think one of the common concerns that every time when we are working with these farms is what happens after hours. So the farms, obviously, they have their workers living in their bunkhouses or in any kind of accommodation. But what happens after they finish their work, they have limited control on who they are meeting and where they're going and how they can keep them safe. So that's number one. The number two is the screening practices that what we are seeing is, and it's already under our Section 22 order as well, that we want them to have a good screening tool that they're using for all their workers, and that is what we are requesting them. So the screening tool allows them to pick up any early symptomatic individual and try to isolate them. The IPAC practices in terms of when people are coming in, whether they are cohorting appropriately, what we have recommended is for example, if you have a bunkhouse with, let's say, 15 people in it, we expect these 15 people to live together, come to work together, and when they're using a shared space, those are the people who are sharing that space. So that's why, if worst case scenario, if that particular house is infected, it's not spilling onto other homes. So we're finding that sometimes these cohorting is not happening. It's also under our Section 22 order to make sure that people are cohorting appropriately. It's also important for them to provide them with the cleaning practices, ensuring that they have soap and water, alcohol-based hand sanitizer, everything that they need to clean their work environment, clean their living environment, and ensuring that they are following all those measures. Those are some of the things that we are finding. Sometimes it's hard to implement and enforce by their employers, and we are working with them to make sure that they have all the tools, they have the right questionnaire, they're documenting it appropriately in different languages, and then they are keeping a track on that to identify anyone who is exhibiting any symptoms to take early action and take them off work and isolate them appropriately. So those are generally some of the concerns that we are finding.
Okay, thank you.
Any further questions from Blackburn?
No, thank you.
Windsor-Star?
I guess, Doctor, do you have a message for members of the community as we're in stage yellow? Things have gotten worse. They need to do more. What's your message for them?
Well, I think the important piece is, and again, I completely get it. I recognize that all of us have been following many of these measures, and what I can tell you is there's a lot of work that's been happening in terms of the vaccine front. There are many candidate vaccines that are showing some promising results. It's not going to last forever, and I think it is really important that we take that into consideration and try to minimize however ways we can to reduce our number of close contacts. And I said this, I think, last Friday as well, and I would repeat it again. These social gatherings, the people that you're meeting or getting in close contact with, it's not a safe activity. Just because that you know those people, it's great, and I can tell you for most of the part, these people may not even know if they're infectious, and they can still infect you. And I know many people personally, my colleagues and my friends who got impacted by COVID personally. I know them, and I'm sure many of you also know many of your colleagues, many of your friends, many of your family members impacted by COVID. It can be devastating. It can be dangerous for people, even in the younger age. So it is important. It is not a benign disease. Please take that in mind and do your part as much as you can in a safe manner. The most safest thing that you can do is to minimize your number of close contacts and always maintain your 2 meters physical distancing.
Thank you.
Any further questions from AMA 100?
Dr. Ahmed, I'm not sure if you can get into this, but going back to the number of people in hospital, CBC asked a similar question, but the age range, do you know the youngest age of a person in hospital right now?
Maybe what I can do is I can ask my epi to provide a limited epi summary for the hospital people, if that is of interest to all of you, and share it with everyone.
Okay, that works. That's it for me today. Thank you.
Any further questions from CBC?
I'm all good, thanks.
Okay, thank you, everyone.
Thank you.